like to read out the questions?
Sure. The first question is, USP is responsible for quality only, not safety and efficacy. This is true, false, or don't know. Second question is, like for chemical medicines, USP develops specific monograph for biologics, such as monoclonal antibodies or vaccines. And the third question is, there are 70 on-demand courses related to biologics. True, I don't know, false, and so on. So this poll will be open for the entire session, and at the end of the webinar, we will give the results to the audience. Okay, next slide, please. Okay, so this is the mission of the USP, to improve global public health through public standards and related programs that help ensure the quality, safety, and benefits of medicine and foods. Since 1820, USP has been setting standards that help ensure quality, safety, and benefits of medicines. More recently, standards are also developed for dietary supplements as well as food ingredients. USP also provides a large variety of related services that contribute to support quality of the drugs. This webinar was specifically designed to help bioindustry understanding the activities and resources now available at USP. Next slide, please. USP is a very large organization with roughly 1,200 employees around the world. We are a science-driven, not-for-profit organization headquartered in Rockville, Maryland, close to Washington, D.C., and also located in various countries such as Brazil, Switzerland, India, and China, as you can see on this map. We work globally. This is because USP standards are used in approximately 150 countries all around the world. And our standards are used by manufacturers, whether they market their product in USA or locally, because USP is recognized in many different countries around the world. Next slide. USP is working with many kind of stakeholders around the world to benefit from their expertise. On this page, you can see USP works in close cooperation with industry, practitioners, and government scientists to develop those standards that are official and recognized by the US Food and Cosmetic Act of 1938. Those standards are enforced in the United States by the US FDA. So USP and FDA are two different entities. We set standards and US FDA enforce those standards because of this law from 1938. Next slide, please. Next slide.
It is on the next slide, Beno. The USP 2025 Council of Experts.
I don't see it.
Yeah.
I can see the slide.
Okay. So on this slide of the Council of Experts 2020-2025, you can see that there are there are 29 committees. USP works with around 900 scientists from all around the world, each of them having specific expertise to support and monitor the development of USP standards. This is why we consider those volunteers are extremely important to USP. They provide us with their own expertise. Those volunteers form the Council of Experts and are spread into 29 committees. As you can see on this page, not less than 5 expert committees are dealing with biologics. Next slide, please. For some reason, I don't see the slides.
It's the monograph and reference standard process.
This graphic describes the way our standards, either documentary standards or physical standards, are developed. Documentary standards are either specific individual monograph or general chapters that usually contain validated methods. My colleague Nikhil will talk about those documents related to biologics after my speech. These documents present the 5 steps of the development process. The first step, USP collaborate with expert submatters. And on the second step, evaluate, USP prepares a draft. And this draft is published into the pharmaceutical forum.
Can we hear Benoit? Sorry, I will just take over while Benoit sorts out his connection issues, and he'll be online once he's back. Just to continue what Benoit was talking about, the process of how monographs and reference standards are developed. Initially, there is a stage where we collaborate with industry and other stakeholders from regulatory academias. We evaluate the proposal and the insights that we get from those stakeholders. That gets submitted for a public review for 90 days. And then we assign those selected ones to an expert committee that Benoit mentioned in the previous slide. Based on the feedback on the expert committee and the approval, the standards get published, both the monographs as well as the reference standard. This one just talks about the various different public standards that USP is into. It's USP NF, which is mostly around the pharmaceutical standards. Then we also have a food chemicals codex, USAN, and dietary supplements, DSC, and other kinds of public standards that we have in different categories. This slide talks about what a USP-NF is about. It's a hierarchical pyramid, as you can see. At the bottom, we have general notices, which are just informational information based on which general chapters are written. We have 2 categories of general chapters, one below 1,000 and the other one is above 1,000. And I'll speak about these chapters from a biologics context in my slide later on. And the last one is the monograph. So a lot of the industry are aware of USP's involvement in monograph development. For biologics also, we have a few monographs, but mostly it's around general chapters. So this is where my part comes in. I'm going to give you a brief overview of the biologics offerings at USP. So the biologics reference standards at USP, in fact, both the standards, reference and documentary standards, they follow the same robust process that world knows of with USP standards development. The first stage is, like I mentioned, we collaborate with extensive stakeholders from industry, regulatory bodies, academia, and other stakeholders. Based on the insights that we get from them, we evaluate the proposal and we submit that to the USP expert committee that Benoit mentioned in the beginning of his presentation. Based on the feedback of the expert committee, we test those candidate reference standards. And the physical reference standards are tested across different labs using different platforms. So it gives a really wide scale application of the same reference standard, and it's quite robust. Once the test results come, that gets submitted again to the USP expert committee for approval, and then we launch the reference standard going ahead. I'm going to talk about now specifically on biologics. Given how biologics is evolving as science, and so does the process of reference standards or a documentary standard. Historically, in biologics, some of the reference standards were generic in nature. As you can see on the slide, some of the examples initially were a separate chapter on development of biological assays, analysis, and validation. That became a little bit more concise in terms of a single chapter for the design and analysis. But then given the advance in biologics, there was a need for a niche and specific chapter for the product itself. And that's how we came up with the insulin assay. And of course, the gold standard in reference standards is having a monograph, which in this example is the insulin monograph. So what we have at USP is similar to the small molecules with a slight difference. Reference standards that we have for biologics, we have product specific standards and something unique that only USP offers, which is called a performance standard. And I will come to and talk about it in a bit. Documentary standards, again, we have some monographs, but mostly we have general chapters, both above 1,000 and below 1,000. The reason we have these general chapters is to allow a certain flexibility in the biologics industry, given the lack of monographs or a lack of reference standards, as you may say. Having a general chapter allows that flexibility to a manufacturer to use their methods, use their process development. And lastly, we have quite a few on-demand courses. We have around 90 on-demand courses that Benoit will speak back online later on in the presentation. And we organize regularly live webinars such as this one. So this is a screenshot of from our webpage on biologics. You can see that we have protein standards around erythropoietin, monoclonal antibodies. Then we have peptide standards. We have certain standards primarily on documentary standards on cell, gene, and tissues, and vaccine standards as well. So what is unique about the USP's performance standard versus the other standards that USP is known for in small molecules? As you are aware that USP has been involved with product-specific standards for most of its years, where we have monographs and associated reference standards. Even for biologics, we do have certain monographs, for example, filgrastim and insulin, and associated reference standards, but not for all. So given this gap that we don't have a product-specific standard, we've come up with something that we term as performance standard. So what is a performance standard? So performance standards are these physical reference standards that can be broadly applicable across product families or drug classes. And the reason being that they can support analytical testing throughout the product lifecycle. And I'll explain this using an example. One of our products is MAB001, which is an IgG1 based antibody. If a company were to develop a biosimilar for adalimumab, for example, which is an IgG1 based antibody, they can only use an adalimumab for developing biosimilars for that. But if they had another project on trastuzumab, they would have to acquire a trastuzumab specific antibody. Now, what performance standard does, it bridges that difference. So you can use the same IgG1 and MAB001 standard across different product cycles and throughout the analytical testing. So giving a lot of flexibility to users when they use it. These are some other examples of the standards that are available at USP. I spoke about the monoclonal antibody, IgG1. So we have something called a system suitability standard that one can use in the size chromatography and capillary electrophoresis for characterizing that antibody. When it comes to impurity analysis, we have a CHO genomic DNA and an E. coli genomic DNA that can help manufacturers analyzing their impurities both in upstream as well as downstream. And the third category is the glycan analysis. So we've got a few oligos mixtures that are comprised of different kinds of glycans that can again be used as a standard to analyze the glycosylation of the molecule of interest that they are studying. So further into our MAB. So our MAB is a performance standard that supports optimization, method development, analytical method development, and system suitability. Not just for one, but different critical quality parameters like glycosylation, charge variance, and any other impurities. We have used the multi-attribute method, and which we anticipate is the future for biologics characterization, and our MAB has been evaluated in using the multi-attribute method. And like I mentioned earlier, one of the key strengths of USP reference standards is our multi-platform, multi-lab testing. So even the MAB went through something called a round-robin study to test for its specification. On your right, you can see a infographic which neatly describes the life cycle of therapeutic antibody development, both upstream and downstream. And what you can see is an associated chapter, USP chapter, and a reference standard that one can use at different stages of their manufacturing cycle. This is a bit more in detail about the IgG1 standard that we have. It's a humanized monoclonal antibody expressed in CHO cell. It has been tested extensively in different labs and in both upstream and downstream methods. And it has been characterized for multiple critical quality attributes, such as the ones you see on the left-hand side. Moving on to the second category of USP Biologics offering is the peptides. So they are our largest class in the department. But as you know, the FDA standards is the biologics is only which has more than 40 amino acids. So we have over 52 peptides in the catalog, ranging from product specific to system suitability standards that can be used for product analysis, impurity test analysis, and even for other critical quality attributes such as identity, strength, quality. These are some of the examples of peptides that we have. Insulin, we've got a few monographs associated with the reference standard and journal chapters. Similarly for bivalirudin and exenatide as well. The next category that we have at USP is the response therapy that we call cell, gene, and tissue related products. We, apart from a reference standard, the way we are supporting the industry is through journal chapters focusing around raw materials and ancillary materials. Given the need and the stage of cell and gene therapy at the moment, there is an important need for qualification, verification of raw materials, both as a drug substance as well as a drug product. And we have a chapter, for example, 1043 that talks ancillary materials that provides guidance for selection, how do you characterize, how do you qualify a vendor, and other QC and QA parameters for cell and gene therapy products. On your right, these are just some of the examples of the physical reference standard that we have associated with documentary standards. Moving to the last category in biologics is the vaccines. Given how the pandemic started and evolved and the immediate need that the world had, USP came up with a new method of helping the public systems, which is through toolkits. So the toolkits that we have at the moment are general guidelines that help across the product life cycle of a vaccine, right from manufacturing, characterizing, analyzing the critical quality attributes, storage, and transportation. So what we have in vaccines are few general chapters, catering to both kinds of platforms, the viral vectors as well as the mRNA vaccines. And some of the chapters that you see on the screen are specific to those platforms. And depending on the chapter that you will be accessing, if it's for a viral vector or an mRNA, you can choose which quality attribute you want to identify and study, whether it's for identity, purity, and other forms of analysis. This is my last slide. Over to you, Benoit. Are you back?
Yes, I am back, and I must apologize because for some reason the WebEx session was completely frozen, and it looks like my speech was not delivered to you completely. So I'm really sorry. I had to disconnect and reconnect again. I hope you can hear me well now. Okay, so thank you, Nikhil. Next slide, please. Okay, so let me talk a little bit about education and workshops. As I mentioned before in my presentation regarding the mission of the USP, we provide a lot of related to support the industry to produce good quality drugs. And education is one of those related programs mentioned in this mission. Education courses are developed and taught by USP staff and USP volunteers. Those courses cover a very vast range of topics in 8 different areas: drug products and APIs, biologics, good manufacturing practices, and so forth. Those courses are available either as live courses, that be a classroom with a physical presence of both student and faculty, or live webcast. Courses can be also delivered as pre-recorded courses. They are available 24/7. And please note that live courses be publicly available or private. We call them also in-house courses. If you go to education.usp.org, you will have the possibility to browse the list of topics by subject and find out which courses are the most relevant to you. If you select a course, you will have the details, the content, the faculty, the duration, the cost, and so forth. So everything is available in education.usp.org. And again, 2 types, live or pre-recorded courses. Next slide, please. Here are a few examples of courses for biologics. And I would like to inform you that a lot of courses are free of charge. Not all of them are charged. A lot of them are actually free of charge. So I will not go through all the courses we have in biologics, but the offering is very vast. And again, if you are interested in education topics on biologics, but also on other topics, I do encourage you to look at the website education.usp.org, where you will find all the details. As you can see, there are a lot of different courses on vaccines, which is a very important topic nowadays, but also on monoclonal antibodies and other topics for biologics. Next slide, please. On this page, several links are mentioned. USPNF, of course, contains the official documents, the monograph, the journal chapter, the journal notices that I mentioned to you earlier, although you may not have heard me at that time. There is a specific page on regarding USP biologics that Nikhil presented to you already on USP website. We have also a specific catalog for biologic reference standards in the store of USP. The USP also has a page dedicated to vaccines and COVID-19 vaccines. And the last one I wanted to talk about is the newsletter and updates. This is something I would like to emphasize because in this link, you have the possibility to sign up to receive USP latest newsletter and updates. They are free of charge, and they are about for instance, biologics, companion notices. There is also the standard newsletter, which is the most comprehensive newsletter regarding USP. And if you go to this link, you will have the possibility to sign up to receive those newsletters. Next slide, please. Here you will find a list of contact. We have a dedicated team for reference standards, where if you have any question on the use, the storage, testing, and other technical issues, you may contact rstech@usp.org. We also have a link for USP monograph, including biologic, if you have any question regarding biologics and monograph in general, you may contact stdsmonograph@usp.org, and so on and so on. For biologics, however, it is recommended to reach either the USP scientific liaison. The name of this scientific liaison at USP is mentioned on the document in USPNF or in the Pharmacopeal Forum. And an even easier way to get information is to reach out to Nikhil or myself. If you have any question on biologics, you can reach out to Nikhil or myself, and we will forward the question to our colleagues in the United States. Thank you. With that, I have completed my part. The floor is open for Q&A, and I will hand over the mic to Nikhil and Jan maybe first.
Do you want the poll results right now?
Yes.
Okay. Should be able to see the results. Are you able to see the results?
Yeah.
Okay.
Yes. So the first thing is USP is responsible for quality, not for safety and efficacy. Yeah, that is true. USP is responsible for quality only, because the safety and the efficacy is actually under the responsibility of the FDA. I don't see the entire question. Like for chemicals, oh yeah, like for chemical medicines, USP developed a specific monograph for biologics such as monoclonal antibodies or vaccines. No, well, I mean, we do have a specific monograph for biologics, and we call those monograph. We have monograph for what we call legacy products, such as insulin, heparin, filgrastim, and so on. But for monoclonal antibodies, for large proteins, for vaccines, USP has no specific monograph. Rather, as Nikhil explained earlier, we have a lot of general chapters, toolkits, all kind of documents around the monograph, but we don't have specific monograph for those very sophisticated products. This is really based on the fact that monoclonal antibodies, for instance, are really manufacturer specific, if I may say so. There are 70 on-demand courses related to biologics. In my presentation, I mentioned earlier today that we have 96 courses on biologics, and so we are above 70, and a lot of them are free of charge, as I mentioned before, and they cover a very vast series of topics. Thank you. So let's move to the Q&A session. Nikhil, the floor is yours.
Yeah. So while we wait for any of the attendees to ask things, I can just talk about the experience that we usually get in terms of questions asked by different audiences. So one of them that even Benoit touched upon is, do we have a monograph, or if not about a monograph, is there an obligatory requirement for a manufacturer to use a USP reference standard in biologics? And the simple answer is no. There is no obligation to use the USP reference standard for biologics, like how it is in case of small molecules. But we push for using a performance standard, which again can help manufacturers in their process development or method development. So I say again that it's not an obligatory requirement to be used for any of the internal studies. I see another question popping. Can you please clarify round robin study for MABs you refer to? Yeah. So like Benoit mentioned, as part of the process of how does a USP develop its reference standard, we collaborate with different labs, not just internal, but also external labs. For example, we have a lab in Rockwell, India, China. And apart from a USP lab, we also collaborate with external collaborators. So the round robin study is based on our MAB, so IgG1 antibody. The idea is to understand the application of the same reference standard being tested in different labs as well as different platforms. And if it's in a different lab,
but the lab is also own method. This allows for kind of like a rich data that we can have for the same monoclonal antibody,
and eventually as a reference going in future. Still open. Any one of you is interested, please do get in touch with us. We'll be happy to documents and around the round robin study.
Yeah.
Oh, sorry, I don't see any others. But maybe you have some typical other questions that you have encountered before you want to share?
Yeah. So the other ones, like I had a slide on cell, gene, and tissue therapy. Do we have any reference standard? And again, the answer is no. For physical, but we have documentary standards. In the field, are fairly new and an evolved.
We are some of chapters, especially around the raw and raw material
verification, or assessment and other validation service for raw materials. So that is where for cell, gene, and tissue related products that we have. So if there are no other questions, anything else that we can discuss and will be
Yes, I see actually two other questions. How we is training and education courses? Well, as I mentioned before, there is in the USP website a possibility to subscribe to newsletters and information. I mentioned the one biologics, and there is a newsletter dedicated to education. And this is a very interesting one. You when you sign this scheduled public, which is of course quite of interest. So I would suggest to sign education newsletter. Another question maybe for you, Nikhil. Are there any cross-country comparing your standards with countries such as China and others?
So thanks, Shi. The round robin study is on the similar form. In fact, we do have labs, I think, in China who are using our maps for that study. And if you are keen on testing the maps again, do get in touch with either us, and we'll put you in touch with the USP China office.
Okay, thank you. Another question is USP develop PA. Well, first of all, I think I need to talk about PI. What are PI? PI are pharmaceutical analytical impurities, and they are what we call non-compendial impurities. When we talk about impurities, we have impurities as standards because there is a specific monograph. But of course, we provide compendial impurities only if there is a need in a specific monograph. There are other for which still the company may have a need for analytical work. USP recently created PIs, pharmaceutical analytical impurities, and those impurities are, as I said, non-compendial impurities. They are not required in a monograph. Still, they can be used in analytical work. So, guys, for biologics, no, we do not. Are only for chemical medicine. So, thank you.
And I can a bit more on in terms of impurity analysis. The slide that we have genome and E. coli genomic DNA, which are used for impurity analysis both downstream. On the other hand, if you use the monoclonal antibody as a standard in size exclusion photography, that can for of your protein, whether you want to analyze the monomer or a low species or a high molecular weight species. So that's of testing the purity of your protein of interest.
Another is quite current question, of course. We are starting MR manufacturing. What can you offer to support this area?
So, should I answer that, Benoit, or you have something else I can? So, for the mRNA, we kit for characterizing the different critical quality attributes, both platform as well as viral vector. Is
gives a neat what are the attributes used that platform. You can download and read. Yeah.
From Procedure is ready in USP with AZIDOM. I don't understand the question actually. If that, do you see the question, Nikhil, in the chat?
Is it in the chat?
Yes.
Can you repeat the?
NDMA proceed in USP with AZIDOM.
I don't get.
No, me neither.
Yeah. Maybe
Okay. If Fadi Hawash can maybe elaborate the comment or the question, maybe useful. Otherwise, do we have any other question? I don't think so. For the timing. No other question.
Another question popped.
Oh yes.
We plan a G. Yes, it is in the pipeline. 2 and 4 is under evaluation.
Okay. This overview, thank you. In an area that was highlighted in the biologic space, multi-attribute methods. How do I information on this topic?
So I can answer that. So we have a launch 2 weeks ago. What I can do, I can ask Jan to share the collaterals after this webinar, the link of that multi-attribute method community. We have around 100 members and we experiences, technical notes from around the world on that method and how it can be used for biologics characterization.
Another question is maybe for me, required. Do you send data logger with cold chain? No, we do not include a data logger into the was only quite a long. I did not data log in the to the parcel. We have two types of cold shipment. We can put the substance into dry ice, for instance, which is of course limited in the time. But we also have international cold shipment chain where the forwarder is responsible for adding ice the base throughout the shipment. So that is another way to ensure that the product is maintained in temperature, but we do not add sugar into the shipment. Any other?
So I've shared the MAM exchange community. So people can log in and be part of it. Can you see on your side, Benoit and others?
I don't see any other question, no.
Okay.
And you've already asked other proficiency testing standards of USP NSI.
Well, for proficiency is a new service that is provided by USP with the very we create a strategy, a company called Solutions in the United States. is in United States who is expert in proficiency testing for all kind of industry, for food, for environment, as well as pharmacy, of course. And you and MSI allied because I've created specific, what we call schemes, specific to USP. And those schemes, for the time being, are mostly available, for chemical medicine and classical, let's say, general chapters such as, I don't know, titration, HPLC, and so on, microbiology, and so on. There is no proficiency testing on specific to biotechnology yet, but this is something we are considering, but it's not available for the time being. Just to clarify, proficiency testing is a way to assess the performance an individual to carry out a specific lab comparison that is organized by MSI with the support of. So there is no proficiency testing schemes so far for biologics.
We've got another. Could you please explain your activity in cell and gene therapy could be applicable now? Yes. Answer this in two ways. One, in terms of reference standard, we have supporting reference standards in the sense a CD34 cell enumeration system that is used to identify the progenitor cells and stem cell. Have collagenase 1 and 2, then even endotoxin, which are again supporting reference standards. In documentary reference standards, we have a few chapters which are specific for cell therapy. Another which is gene therapy, still in the whole development, verification, those kind of things. Yeah.
Another question: you come with biomarkers offer, and what include?
So markers is something new that USP. We've just started doing our initial research, and the focus will be around neurological biomarkers, cardiovascular disease biomarkers, and cancer-related biomarkers, and again, therapeutic biomarkers. Give us a year's time, we will come up with a bit more detail what exactly those biomarkers will look like, names. But yes, it is in the pipeline. Yeah.
We are developing trastuzumab biosimilar in early phase now. How you could support us? That's a very interesting question because biosimilar is very activity right now.
So it is an IgG-based antibody. You can use the three maps that I showed in the presentation with different with different quality attributes, and you can use that for upstream and downstream methods. Say for example, in your SEC, yes, those kind of methods to this is third.
Yeah. Performance standards are very useful and can be used in many different applications.
Yeah.
Well, a question, maybe Chance. How we can learn Panjin? Is there any webinar?
So not at the moment, but we have recorded workshops that you can access, along with some other courses. And also USP education website. Courses, there are a few workshop videos you can, but yes, this was just a biologics. We will put specific webinars and other forms of references to talk for or just categories that we
we are done for today. Thank you very much for your presence, for attending to this webinar. To understand resources that USP has active for chemical, but of course, considering that the pharmaceutical is extremely with biologics, considering the difference biologics and chemical medicines, we are also to support the pharmaceutical industry in their activity around the biologics, but done in a lot of activity USP and webinar, let's say, provide relevant information and will help you your daily activity when manufacturing those biologics. So thank you very much. Nikhil, if you have any last word.
No, that's it. Beginning, we will come up with more webinars and other opportunities to interact. So please get in touch with the representatives in your region, and we'll be happy to user forums and other company-specific presentations. Thank you.
Said indeed, we are always available. You can reach out to us if you have any question, and we will make sure that the appropriate in a time. Don't free to reach out to us. Okay.
I just have one more here.
Okay.
I guess it was privately. Just 30 seconds. How can I download updated USP chapters?
USP chapters are available in the US. So you need to get a subscription to access to USP, and so they are there.
Thank you. All right.
Okay.
Thank you, everyone. Thank you, Nikhil, for a very interesting session and lots of information. Again, participants, if you have any further questions, please feel free to reach out to us directly at the email addresses that Nikhil has provided, or you can also write to us at emea@usp.org. So emea@usp.org. And we also have further resources on our webpage. We also do have a newsletter that you can subscribe to. So please feel free, if you want to stay with us, to get our monthly newsletter as well. All right. Well, we'll conclude it. Okay. Thank you very much again. Please stay safe, stay healthy, and we hope to see you again soon.
Thank you.
Bye, everyone.
Thank you.
Thank
Bye.
you.
Thank you.